The scenario you're about to see is a pretty typical adolescent healthcare interview that can be done by any healthcare provider. It's a young woman who's presenting for an annual physical exam, and she had reported in her screening tool that she uses marijuana about 2 to 3 times a week, casually, socially with friends. Hi, Chloe. I'm Scott Harp, and I'm one of the public health nurse case managers here at the Adolescent Medicine Clinic. One of my jobs is to meet with all the adolescent patients that come in to see our nurse practitioners and our physicians. And I usually spend some time just to kind of get the background information and get some background history and go through the screening tools that you did before you came in today. It'll take probably about 15, 20 minutes or so, and then we'll make sure we get you in to see your provider here today. So is that okay if we chat for a little bit? Yeah. Fantastic. With every adolescent patient that I meet with, I just make sure I remind you that everything you say that we talk about here is kept confidential, except for 3 circumstances, and that's if you plan to hurt yourself, if you're planning to hurt anybody else, or if someone is hurting you. And then we'll talk about that at the end and figure out if we need to involve anyone else. So does that sound like an okay plan to keep everything between us today? I usually ask a little bit about home, school life, activities that you like to do. We like to ask mental health questions. We're going to spend some time with the substance abuse questionnaire that you did, sexual health things, and just tell me as much or as little as you want, and I'll kind of fine-tune answers as we go. So I'm just going to ask a couple questions about home, because you said that you live with your mom and dad, and you have a little sister. You want to just tell me just briefly a little bit more about that?
Yeah, my mom and dad are cool, I guess. My sister, she's annoying.
She's annoying.
But she's 9, so
yeah,
comes with the territory, I guess.
She wants to be like her big sister, likewise.
Yeah,
hanging on.
she always wants to tag along or be in my room with me. And, yeah.
So you have a good relationship with your parents. Are you closer with one or the other?
Probably my mom. Yeah.
Great. On your screening tool, you talk about going to Thomas Jefferson High School. You're a senior there, and that you're thinking about going to college. How much do you talk to your parents about what you want to do for your future?
Pretty often, especially now, being a senior. They're like,
yeah.
What do you want to do? What are you going to do? And I don't know. I'm kind of still deciding. I don't know if I want to take a year off or go straight to school. It's a lot up in the air right now.
It's wonderful you have that relationship with your parents and can kind of work through some of that with you. What are some of the after-school activities, or what are some of the classes that you like best at your school?
I really like government. It's one of my classes. Drama is pretty cool. And then try to be involved with student council and things like that.
So we had you fill out a bunch of survey tools, specifically about substance use. I wanted to talk to you a bit about that, because we usually try to spend a little bit more time with teenagers talking about substances and sexual health questioning. One of the tools that we talked about asks about drinking, smoking, using marijuana, and any other hard drugs. You had checked the box that you use marijuana, so I just wanted to ask you a little bit more about that and kind of get your feelings around that. Is that all right?
Yeah.
And just a reminder, everything we talk about today is confidential, so just feel safe that you can tell me what you want, and it won't get back to anybody else. Now, I was surprised to see that you didn't use as much alcohol. You just kind of said very occasionally, once a month, which is great. Tell me more about the marijuana use, because you mentioned on the screening tool that was about 2 or 3 times a week. So first, is that accurate? And maybe tell me a little bit more about the circumstances.
Yeah, it's just a few times a week, and usually with my friends.
Tell me a little bit about what you like about smoking.
I guess it just makes me feel relaxed and a little more chill, so yeah.
Are there any other methods of marijuana that you like to use, or that you've tried?
Edibles or something like that?
Yeah.
Yeah, kind of I've made brownies before, and that's about it.
And did you have the same effect with those, or did you have any not so good feelings with those? Because we hear stories of people feeling pretty zonked out with taking those.
I think the effect, you can feel it more when it's like that, but yeah.
So you alluded to in here that you usually smoked with your friends. Are there any other people, boyfriend, girlfriend that you might use marijuana with?
My boyfriend doesn't smoke. He hates smoking. So
Oh, okay.
yeah. So it's just usually with my friends or like by myself.
Or by yourself? Okay. How would your parents feel if they knew that you were smoking marijuana?
Mad. I don't know. I feel like they kind of know because they've like smelled it and stuff before. Like the friends I hang out with, and they kind of try to give me the lecture about how it's bad and everything. But.
Yeah. What are some not so good things that you've experienced with smoking marijuana? And you kind of alluded to your boyfriend doesn't like it.
Yeah. Yeah. He always thinks I'm like spending more time with my friends and smoking and than him. But he plays sports, so I'm just like, he's just as busy. So like want to hang out with my friends and do something. Right. And I usually feel fine. There's sometimes where I'm a little foggy, like the next day, if I smoke like at night and then go to school. But other than that, I'm usually okay.
Yeah. Tell me a little bit more about that foggy on the next morning.
I just don't feel like, sometimes I just don't feel like all the way, like normal, I guess, or right. And sometimes I think like maybe I'm just tired or like, waking up early, but.
Have you ever used marijuana during school hours or at school?
No. No, I haven't because I feel like I probably would be off and like, especially since I feel like relaxed when I do it, I feel like I'd be like falling asleep in class.
Right, you've described how having good grades and doing well in classes is really important to you, and that could potentially adversely affect. Chloe, thank you for sharing this with me. If I could quick summarize, what I hear you saying is that you use marijuana, usually smoking, sometimes brownies, probably 2, 3, sometimes 4 times a week. You mostly do that with your friends, and it's kind of more of a casual social thing. It makes you kind of feel chill and kind of forget about some of the stuff that's happening in the world today. On the other hand, your boyfriend doesn't like that. He thinks that it might not be so good for the time that you spend together. Sometimes you are foggy when you kind of wake up the next morning, go to school, and you're afraid it potentially could impact how you perform in school. Is it okay if I give you some feedback about what we know and what we don't know about marijuana use in adolescence? Good, thank you. One of the things that we don't know very well is what a safe level of use is in adolescents, or really adults for that matter. Especially here in Colorado, as you probably know, there's different potencies, and especially if you're using any marijuana from the street, that it could be very potent and we would have no idea. So that's there's research happening, but we simply don't know. What we do know is that in previous studies that teens have had some concentration issues, some memory problems, and maybe longer term things that we are still studying. So we just don't know as much as we should. So we just really want to have adolescents especially kind of approach with caution. And we do know that the adolescent brain is growing until the young 20s. So we would say, let's not harm it. And so we highly recommend not using marijuana just to kind of preserve that. So what do you think about that, hearing those facts?
I feel like as long as it's not like all the time or like in moderation, I would be okay. Yeah.
So what I heard you just say is that, moderation is probably good. And we've kind of talked a bit about some of the, the pros and cons of how you're using now. So I guess my question, kind of knowing that, not using is probably like the best practice. How ready do you think you might be towards using maybe even a little less than what you're using now?
I mean, I could do that, I guess.
Right.
Yeah.
So I have a kind of a ruler here on a scale of 1 to 10. So if you had to give it a number of how ready you might be, what would you probably rate yourself at? With 0 being not at all and 10 being extremely likely that you want to change.
4. Yeah.
Okay, so
4 or
4.
5.
That's good. So what makes you a 4 or 5 and not a 1? Like, absolutely, I don't want to change.
I guess just knowing like how my boyfriend doesn't really like it, and I feel like he lectures me.
Yeah.
And just thinking like, I don't know, I guess like about my parents and my sister and stuff. I don't want to like get addicted or like start to want it more often than I already do. So.
Excellent. And what would make you, like, what would move you up to a 7, 8, 9 as really likely to change if you were going to be there?
I don't know. I guess like if it started affecting me or something to where I needed to like quit cold turkey, I guess you could say.
Right. I think having kind of a timeline with your boyfriend, if that was certainly a goal that it sounds like he wants to help you meet, kind of figure out what that would look like. Chloe, I wanted to thank you for talking to me today. I hear a lot of really cool things that are happening in your life. You have a great relationship with your mom and dad. Your little sister's annoying, but you like being at home. Your high school experience is great. You're thinking about college, but you're also going to possibly travel the world for a year. You're doing great in school, politics, drama. You've talked about marijuana use and how you might potentially look at changing and kind of backing off on that a little bit. So thank you for being so honest, and I'll take you back to the waiting room. Well, Chloe, we've talked about a lot of things, but I really need to talk to you a bit more about your marijuana use. You said on your screening tool that you're using 4, 5, 6 times a week, and you're doing that with your friends. That's really risky. I think we need to talk more about that. What are you afraid of getting busted? What do you think how would that affect your life?
I'm not really worried about it. Like, it's not that big of a deal.
How do you think your parents would feel? I mean, you spoke of having a pretty good relationship with them. Would they be upset and sad about that?
I mean, yeah, but I don't think it would be like the end of the world.
Going to college, like, do you think smoking weed could potentially affect you getting into the colleges that you want to go to?
Yeah, I mean, if someone snitched and said I was smoking, probably. But.
Right. I got to tell you, as a professor and a scientist here and as a nurse practitioner, that we don't know enough about smoking weed, but we know that kids shouldn't be using it. We've linked marijuana use in adolescence to a lifetime of problems, high-risk behaviors, dropout, substance use disorders, and really, it's really important just to stop smoking. So I really, really want you to think about that. So I'm telling you this stuff is bad. You just need to listen to what I'm telling you and really consider stopping your marijuana use.
Okay. Is that all? Like, can I go? Or?
Yes, you can go, but I really want you to think about what we've talked about today.
Got it.
Okay. When I approach my interview with the adolescent, it's all about rapport building. You spend a considerable amount of time setting the stage for what you're going to be talking about. We tend to spend more time leading into the sensitive questions, asking about the protective factors and the healthy youth development that they are experiencing, the resiliency if they're an at-risk kid, and really setting the stage for them recognizing what great things they have going for them before we dig into the risk behaviors, the drinking, the bad mental health, and this risky sexual health behaviors. Because if you try to dig deeper into those risky things, they're going to shut down and not tell you what you need to know. There are many different strategies that we use in the adolescent interview. Open-ended questions are absolutely key. And that's hard because adolescents tend to be ones that are readily interested in answering yes/no questions and that alone. And then they go into a provider's office expecting to fill out the check boxes and that they have only 5 to 10 minutes with the provider to get through their interview. So we ask a lot of open-ended questions, and you also have to use the tell me more technique and kind of pull a little bit more out to kind of get a deeper response. And what you saw in the interview is I do a lot more summary and kind of a cross-checking of facts that the kids tell us, just to make sure that we get their story right in a way that kind of honors the time that we have with them by reaffirming what they've told us. Well, preceding this, that I didn't talk about momentarily, was the confidentiality statement, and that's always really, really important with teens. So like I did with the actor, we went over the confidentiality to kind of be a bookend, in a sense, to the overall interview, and then we reaffirm that when we get to the sensitive question. So when risky questions are asked or kind of sensitive questions are asked, it's kind of a natural flow to get into the summary. And I think a lot of providers, the pitfall is that they start negotiating when they first hear those risky behaviors, maybe earlier on in the interview. So that's kind of one teaching thing that we like to do with residents and nurse practitioners and other healthcare providers, to really save that negotiation and kind of the care game plan for the very end. After things are summarized, after both positive things in the interview and kind of things to work on happen, so then the negotiation clearly is the last thing that the young person leaves with when they leave the office.